Hi there, this is Nursing Education Videos. Today I will be reading Hypocalcemia NCLEX Review on registerednursern.com. All credit for this information that I am reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. Disclaimer from registerednursern.com. This video is for educational purposes only and is not intended as medical advice. While we strive for 100% accuracy, errors may occur and medications or protocols may change over time. Hypocalcemia NCLEX Review Notes. Studying hypocalcemia and want to know how to remember hypocalcemia and how it is different from hypercalcemia. In this article, I want to give you some super easy ways on how to remember the causes of hypocalcemia, signs and symptoms, and the nursing interventions for this condition. I want to highlight the material you will be tested on in lecture class or the NCLEX exam. After you read these notes, be sure to take the quiz on hypocalcemia and hypercalcemia. Hypo means low, calc is the prefix of calcium, emia is blood. Meaning of hypocalcemia is low calcium in the blood. Normal calcium level is 8.6 to 10.0 milligram per deciliter. Less than 8.6 milligram per deciliter can be considered hypocalcemia. Role of calcium plays a huge role. So calcium plays a huge role in bone and teeth health, along with muscle/nerve function, cell and blood clotting. Calcium is absorbed in the GI system and stored in the bones and then excreted by the kidneys. Vitamin D helps play a role in calcium absorption. In addition, phosphorus and calcium affect each other in the opposite way. For instance, if phosphorus levels are high in the blood, calcium will decrease. If phosphorus levels are low in the blood, calcium will increase. They are always doing the opposite. Remember this because it is important for the causes of hypocalcemia. Causes of hypocalcemia. Remember mnemonic low calcium. L for low parathyroid hormone. This is due to the destruction or removal of the parathyroid gland. Any surgeries of the neck, such as thyroidectomy, you want to check the calcium level. Professors love to ask this on exam. O for oral intake inadequate due to alcoholism, bulimia, etc. W for wound drainage, especially the GI system because this is where calcium is absorbed. C for celiac and Crohn's disease, which causes malabsorption of calcium in the GI tract. A for acute pancreatitis. L for low vitamin D levels, which vitamin D allows for calcium to be reabsorbed. C for chronic kidney issues, excessive excretion of calcium by the kidneys. I for increased phosphorus levels in the blood. Phosphorus and calcium do the opposite of each other. So again, high phosphorus levels in the blood causes a decrease of calcium. U for using medications such as magnesium supplements, laxatives, loop diuretics, and calcium binder drugs. M for mobility issues. So signs and symptoms of hypocalcemia. Remember cramps. C for confusion. R for reflexes hyperactive. A for arrhythmias, so prolonged QT interval and ST interval. Note, definitely remember prolonged QT intervals. It's another major test question. So prolonged QT intervals in hypocalcemia. M for muscle spasms in calves or feet, tetany, and seizures. P for positive trusos. You will see this before Chevostek's sign. Or before tetany. This sign may be positive before other manifestations of hypocalcemia, such as hyperactive reflexes. And then know how to elicit a positive trousseau. You do this by using a blood pressure cuff and place it around the upper arm and inflate it to a greater pressure than the systolic blood pressure and hold it in place for 3 minutes. If it is positive, the hand of the arm where the blood pressure is being taken will start to contract involuntarily. See the teaching tutorial on a demonstration. So I googled it. It means trousseaux. How to elicit a positive trousseau. And then S for signs of Chevostek's. This is the nerve hyperexcitability of the facial nerves. To elicit this response, you would tap at the angle of the jaw via the masseter muscle, and the facial muscles on the same side of the face will contract momentarily. The lips or nose will twitch. So nursing interventions for hypocalcemia. Safety. Prevent falls because patient is at risk for bone fractures, seizure precautions, and watch for laryngeal spasms. Next intervention would be administer IV calcium as ordered. Example, 10% calcium gluconate. Give slowly as ordered. Be on cardiac monitor and watch for cardiac dysrhythmias. Assess for infiltration of phlebitis because it can cause tissue sloughing. Best to give via a central line. Also, watch if patient is on digoxin because this can cause digoxin toxicity. And then another intervention would be administer oral calcium with vitamin D supplements, given after meals or at bedtime with a full glass of water. If phosphorus levels are high, remember phosphorus and calcium do the opposite. The doctor may order aluminum hydroxide antacids, TUMS, to decrease phosphorus levels, which in turn would increase calcium levels, as well as encourage intake of foods high in calcium. The mnemonic would be young Sally's calcium serum continues to mess up, or young Sally's calcium serum continues to randomly mess up. Y for yogurt, S for sardines, C for cheese, S for spinach, C for collard greens, T for tofu, R for rhubarb, M for milk. Thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button and go to registerednursern.com for more information. I hope everyone has a good day.